In about a week and a half, you won't have to wear a mask everywhere you go, and businesses won't have any restrictions. The governor is rolling back the state's COVID protection measures starting April 6th. Brandon Smith reports.
The state is replacing its mask requirement with an advisory, but the state's health commissioner says the science remains the same.
And we've been doing that for the most part across the state, wearing our masks to prevent the spread of this virus to other individuals and prevent ourselves from becoming infected.
Masks will still be required in state government buildings, COVID-19 testing and vaccination sites, and K-12 schools. The state will no longer require restaurants, bars, and nightclubs to keep customers spaced 6 feet apart or seated, though Holcomb says businesses should keep COVID response plans that include safeguards. And local officials can still impose tougher rules in their own communities if they decide that's best.
Ladies and gentlemen, as we continue to do these few things, the light at the end of the tunnel becomes brighter and brighter.
Governor Holcomb says the state's steep declines in coronavirus hospitalization and deaths rates, as well as the growing number of people who are fully vaccinated, justify his decision.
We have the resources to care for those who are in need, meaning ICU beds, doctors, etc. We have a vaccine, 3 of them, as a matter of fact.
Indiana's coronavirus hospitalizations and death rates have fallen by more than 80% since their December peaks. Nevertheless, Indiana still averages about 10 coronavirus-related deaths per day. The state's public health emergency declaration will remain in place through April. Holcomb said that will allow the state to pivot if cases take a turn for the worse. It also ensures Indiana still has access to federal relief. For Indiana Newsdesk, I'm Brandon Smith.
We're joined now by Dr. Richard Feldman, who was the state health commissioner under Democratic Governor Frank O'Bannon. Welcome, Dr. Feldman. You know, the governor has faced a lot of criticism from within his own party about the COVID restrictions that he's imposed. Do you think his decision to lift restrictions is based on science and the best advice from health experts, or is it politically motivated?
Well, before I criticize the governor, I do want to say that for a Republican governor in a very conservative Republican state, I think Governor Holcomb has done really a reasonable job in terms of the mitigation measures and protecting our state, the citizens of our state. However, I think this is unfortunately politically motivated more than based on the advice of public health experts and the science. It's premature, and it's really unfortunate because we're almost there. You know, we are vaccinating. Indiana's had one of the best vaccination systems in the country, and we're almost there. Just a few more months of mitigation, mask wearing, social distancing, washing your hands would be so much better than opening up things, I think, prematurely. Even though the case numbers and the death rates have plummeted, and that's wonderful news, it's still unacceptably high. And I think we have a false sense of security because things decrease so much, but they're still at an unacceptably high level.
You know, you just mentioned about the deaths. They've decreased. It was an 80% drop from December. How significant are those numbers to you?
Well, they're significant. Things are going in the right direction. That doesn't mean that we're ready to open up. And unfortunately, his decision is a punt to local health departments for them to take the political heat, as well as, and think about this, businesses. Businesses were operating under a state mandate for mitigation standards, including, most importantly, mask wearing. Now it's still up to the businesses, but now they're going to take the responsibility rather than the state government.
All right, Doctor, we have to leave it there for now. Thank you very much for your time. We appreciate it.
You're welcome.